Hello and welcome to this video on IV vitamin therapy. This is a recent fad therapy associated with bold health benefit claims. The basic idea is very simple. You are hooked up to an intravenous drip with saline and vitamins. This is infused into your body over the course of an hour or so. Each infusion costs between $185 and $395 an infusion. Some particular examples have been listed at as much as $1,155 each time. This could be substantially less than regular doctors in the USA where it is popular, but in countries with a civilized medical system, the popularity is lower overall and mostly represented amongst the most affluent and well-off. The various claimed benefits about IV therapy include all of the following and then some more again. Faster cold and flu recovery, help with vitamin and nutrient deficiency, treat medical issues, provide antioxidants, fix fatigue and low energy, improve immunity and further aid immunity with vitamin C, reduce the effects and appearance of aging, help with mental fatigue and cognition, help with hangovers and jet lag, rehydration, improve athletic performance, skin brightening and clearing, help with psychological conditions like anxiety and stress, improved wound healing, chemotherapy side effects, detoxify your body, and the list could just keep going on. Nothing mentioned really has any meaning or evidence for it, but hopefully the following will make clear why. Before we even get into the theoretically possible options, we can begin debunking several of these without ever having to go into detail. Jet lag is a sleep disturbance, and it is not an issue corrected with IV therapy. Detoxify is a meaningless idea, as your liver and kidneys do their job regardless. Treat medical issues is too vague to be meaningful or useful, as just about anything could be a medical issue, whether it is erectile dysfunction or a tumor growing in your pituitary. And now for the problems with the remaining claims in mind. The first problem we have with this is rather simple. What need is there for vitamin therapy? The second issue is the physical injury and infection risk. The third is the lack of consideration that this may be unnecessary treatment. The fourth are the complications arising from doing this. Fifth and finally, the lack of evidence. IV vitamin therapy is, at its simplest, just saline and a particular cocktail of vitamins. It can be something as simple as vitamin C alone or vitamin C, B vitamins, calcium and more. Controversially, it can also include things like methylene blue and other questionable vitamin substitutes, precursors and alternatives. If you are following a fundamentally sound diet, none of these are needed. If you are deficient in your dietary intake, the use of an IV line and infusion is also unneeded, as in just about every instance, oral supplementation is just as effective and doesn't involve sticking an IV line into you, which can be a big problem. This is why we would say IV vitamin therapy provides nothing that is not already available in a more effective and convenient manner. If you are in a position where IV therapy is appropriate due to something like absorption issues due to allergies, gastrointestinal damage, and prior treatment like chemotherapy, IV vitamin therapy does make some sense. This would also be prescribed in a medical setting by a regular treating doctor, not a boutique bougie fad IV therapy bar, even if it is a location run by a doctor. Secondary to that, IV vitamin infusions are not needed. They can be provided using a simple injection into either the vein or via other administrative routes that don't need an IV line. The second is if you were to have deficiency due to a lack of dietary intake. This group is also the easiest to resolve and least likely to be attending a very expensive clinic because their diet is poor, because most of the time they are also poor. If instead you are well enough off to be able to afford to attend somewhere like this, but have a terrible diet, for example because you are fad dieting, you are better off attending a dietitian's office and not somewhere like this. Simply attending a very expensive clinic does not make it a good clinic. This leads to the second issue. Using an IV line to deliver an infusion that could as easily, if not more easily, be substituted with an oral medication is unnecessarily dangerous and risky. It is arguably unnecessary medical practice. Any procedure that will pierce your skin creates an opening for pathogens and possible complications. Even providers of IV therapy recognize this as a risk on their website. The problem is, if IV therapy goes wrong, it goes very wrong. Any IV line is a direct entry point to your bloodstream, and if this happens, sepsis is on the way if bacteria get in. The next issue is that it pierces veins, and this can create a risk of blood clots, bruising, allergic reactions, and more. As said, reactions for which the risk is not needed with a suitable, safer alternative. It gets worse though. If the person setting up the infusion is not good at their job, it can lead to an air embolism. This can cause infarcts, things like a heart attack or a stroke. The third problem is that no doctor should be prescribing unnecessary treatments. That is anything from IV hydration, antibiotics, and pain relief to surgery and more. IV hydration or IV vitamin therapy is just such an unnecessary treatment. There is no obvious need in most cases, and even if there is a need for vitamins, there are much better options available. That makes it unnecessary treatment, and it's one of those things that doctors are meant to not do. In fact, it's part of their oath normally. Further, the delivery mechanism of hydration fluid and other contents that make up the cocktail, and it doesn't matter which one this is, these can themselves create complications. Those complications can create more issues and therefore harm the patient and not help them. On top of all of the aforementioned issues of unnecessary treatment, infection risk, and the fundamental problems we have with this, there are further problems that can come from this. And these all boil down to what they are doing in the first place. The whole idea is that it is a bag of saline, varying from 250 milliliters up to a liter, and various solutes. The combination of these two things can be a very big problem. The most immediate issue is the use of saline, and the saline itself is not a problem. It is just a solution of water and salts, but it is the extra water that is taken into the body and needs to be cleared out. Normally, hydration fluids are given under particular circumstances, either where there are problems with low blood pressure, a loss of blood, or similar. You don't just give someone extra fluids for the sake of giving them extra fluids. That is because it needs to be removed by the kidneys. And by clearing it out, the kidneys are working, and they often work harder when you give extra fluids. If you have kidney problems, that does not work out very well in the end. It means the therapy can cause very big complications, and these all are related to both kidney function, kidney damage, and blood pressure related complications. For example, your kidneys can only clear out so much fluid in a given time frame. This works constantly, and your body will reabsorb as much as it can if you haven't taken in extra fluid. If you have, your body needs to remove it, and it does do so, but it also clears out solutes and a lot of other material the body needs. But it takes time. The IV line doesn't necessarily account for this. So when you start adding things like saline with potassium in it, and you do so too quickly, you can suddenly increase the amount of blood pressure in the body and cause a heart attack. If you have heart conditions, blood pressure conditions, kidney issues, and more, all of these can be exacerbated or even create secondary complications that will lead to death or injury. The next and obvious issue is sometimes having excessive levels of certain vitamins and minerals can actually damage the organs themselves. For example, excess iron, things like excess vitamin A. All of these can create problems. Vitamin A is a particularly nasty example. It can have neurotoxic effects. That is, it can have some particularly nasty side effects on your brain. This is because vitamin A can actually pass through the blood-brain barrier with reasonable ease. It can include everything from something as mundane as a headache to pseudotumor cerebri, and then even cytotoxic effects on the brain. Vitamin D3 can also affect the brain, and unfortunately, it doesn't have a positive effect. It can have an effect on the way calcium and phosphorus are all handled in there. Folate, which is one of the more commonly used kinds of vitamins added to these cocktails, and even thiamine can cause seizures and, if not done correctly, have damaging effects on the brain and cerebrospinal fluid production. Ascorbic acid, or vitamin C, also has bad effects on the central nervous system, which is your brain and spinal cord. All of these, even if they are provided to someone under the theoretical observation of a doctor, does not necessarily mean the doctor is going to have the necessary facilities and means available to treat an individual if they develop toxicity from giving them these vitamins in their IV vitamin therapy. The fifth and final issue that we have is the lack of evidence for IV vitamin therapy. There was a very long list of bold claims we gave you at the start of this video, and that is a big problem. No treatment can cure everything. This is why chiropractors, naturopaths, and more are all bunk. They simply cannot realistically fix all the problems in the human body using the same method for everything. There is only one cure to everything, and that is death. This is one reason why there is a lack of evidence. There is no way to establish that one treatment can fix everything. There is a very prevalent issue with a lack of controlled trials, and this means that you cannot find what is the lowest, safest dose of any particular vitamin. That means that once we start pumping in larger amounts of these vitamins that are meant to have a pharmacological effect, we don't know what is safe. This also means that you could theoretically be pumping in way too much, or not enough to have any kind of beneficial effect, and that everything that happens is entirely placebo. The best thing that we have for you is a small number of meta-analyses, systematic reviews, and reviews. The findings from these are not encouraging. In short, there is just not enough support to be able to justify IV vitamin therapy, but there are many possible problems. We've mentioned the extensive issues with vitamin A and how it can have issues because it readily passes through the blood-brain barrier and has an effect on the brain itself. As a consequence of this, vitamin A is more likely to be neurotoxic and damage the brain, and yet you may be getting it in high enough doses to have exactly this effect when you look at how much is given in an IV vitamin therapy session. It is also possible that if you are looking at the other vitamins and minerals that could be included in these treatments, they could be harming other parts of the body, organs, muscles, and similar, because they can't get to the brain. Instead, they damage everything else. There's also the consideration that you have to be aware of any possible complications and interactions, as we've mentioned. As we've said already, there is no controlled trial defining what is the lowest safe dose for a human in terms of the neurotoxic effect of any vitamin. There's also a huge range of variability between individuals. A very large and obese person would be able to deal with more vitamins in their body because there is much more blood in them in which it can be dissolved and spread around. A much smaller individual cannot. This is exactly the same sort of observation around alcohol consumption. A small person cannot drink as much as a large person, and yet both will exhibit neurological effects if you give them enough. Same thing with these IV vitamin therapies. There is a standardized dose available of varying sizes in most of these facilities, and yet it doesn't seem to account for the variability in individuals. Further to that problem is without establishing their dietary intake of any particular vitamin or mineral, you're now adding more on top of that, and this could lead to toxicity issues simply by virtue of not having done the work. Simply put, no IV vitamin therapy does not work any better than perfectly reasonable and more affordable, efficient alternatives. Even with that in mind, it is an unnecessarily invasive therapy. It also carries significantly more risk without any observable and definable evidence to support its use in lieu of better options. It is entirely a fad and one that is completely bizarre and unneeded. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.